Cancer is a leading cause of death worldwide. There were 19 million new cancer cases in 2020. This is expected to grow to 28 million cases in 2040, a rise of 47% from 2020. Therefore, early diagnosis and treatment are essential tools in cancer. It is critical for global cancer control to prevent cancers where possible and to identify cancers as early as possible. If a patient has symptoms that may indicate cancer, it is important for the patient to be well informed and understand their referral and diagnostic pathway, and if cancer is diagnosed, their treatment and follow-up pathways. Our cancer app has been developed to support patients before, during, and after their cancer referral, diagnosis, treatment, and follow-up, so throughout their cancer journey. Let's see how it works. The patient downloads the app to their phone and grants consent for us to hold their data. Then the patient adds their personal details. Note that all data in this video is fictitious and there are no issues of confidentiality or privacy. If they wish, the patient may also add details of their health providers, including address, phone number, and email, etc. Depending on the cancer that is suspected, the app configures for the relevant cancer. So, for example, this patient has symptoms that may indicate colorectal cancer. What is cancer gives a general description to the patient of cancer. Since cancer is suspected, the patient will be referred by their doctor. And the referral and diagnosis section takes the patient through the typical sequence of events. The app can include dates of various procedures on the diagnostic plan. Some of the medical terms may be unfamiliar to the patient, so each has a small eye for information alongside, which when tapped, gives the patient a brief summary of each procedure, for example, CEA blood test. If cancer is diagnosed, then the patient treatment and what happens takes the patient through the different treatments available for colorectal cancer. And again, the patient can select to see a short description of each, for example, chemotherapy. Once the patient's treatment is completed, the patient can see in after treatment what their follow-up should include, again with the explanation of the medical terms. To enable the patient to keep track of the various events on their cancer journey, the app generates automatic action items with a due date for each. This patient is due for the colonoscopy and will also be having a CT scan. Actions that are in red are overdue. Actions in blue are not yet due. To avoid the patient having to constantly refer to the action list to see what is due, 4 weeks before any action is due, the action triggers an automatic alert, which creates a notification on the phone to alert the patient that there is an upcoming action. The app will then automatically alert, remind, and follow up the patient to ensure that the action is carried out. Let's see how that works. The alerts are completely automatic, proactive, and interactive. So, for example, this patient's next colonoscopy is now overdue. If the patient taps yes, as she has already booked her appointment, the app offers her a calendar to enter the date and time of the appointment. The app will then automatically trigger another alert 2 days before the appointment to confirm that she is still attending. So the patient taps yes. And 1 day after the appointment, the app will ask the patient to confirm that she attended. If she did, the action will be automatically updated. Because the alerts are algorithm-based, the messages will vary depending on the answers the patient gives. If the patient taps no at any stage, the algorithm in the app changes the message to encourage the patient to attend and continues to alert, remind, and follow her up for the action, all entirely automatically until the action is completed. So if we look at a different alert, for example, her next gynecology appointment, if she responds that she has not booked an appointment, the app will encourage the patient to book an appointment and ask her again in a few days if she has booked an appointment. If she continues to respond no, the app responds more firmly to ask the patient to book the appointment. If the patient responds no for a third time, the app does not harass the patient and stops the alert, but enables the patient to restart the alert at any time. The actions are driven by data in the patient's medical record in the app. The data for the medical record is obtained either from physicians' electronic medical systems or entered directly by the patient. The app configures automatically for the patient's potential or confirmed cancer diagnosis. So, for example, another patient may have symptoms that may indicate breast cancer. In this case, the app provides a summary of what is breast cancer. The app also includes red flag symptoms that a woman should look for in suspected breast cancer. If the patient and doctor are suspicious of breast cancer, then the patient will be referred, and the referral and diagnostic section takes the patient through the typical sequence of events. Once again, if the patient is unfamiliar with some of the medical terms, each has an eye for information, which shows additional data when tapped, for example, fine needle aspiration. If the patient is subsequently diagnosed with cancer, the section on treatment guides the patient through the different treatments available for breast cancer. Once again, the patient can select a short description of each, for example, breast conserving surgery, as opposed to mastectomy. Once the patient's treatment is complete, the patient can see in the app what their regular follow-up should include, again, with explanation of the medical terms, for example, DEXA scan. The app also contains the patient's full medical record, including a past medical history, her medication, both current and historic, plus all her metrics, including blood pressure, height, and weight. Some doctors have concerns about data that patients enter themselves. So to enable doctors to distinguish which is which, the app has a stethoscope alongside data entered by a healthcare professional and a phone alongside data entered by the patient. The app also includes all her immunizations and her blood tests. The app also contains a telemedicine module where the patient can connect with a nurse or doctor. With patient consent, the doctor or nurse can see the data in the patient's personal care record. The app can also be used to link the patient to authoritative websites with a simple click. The app can also include a resource library on any topic of authoritative information. This content can be localized to the country, region, and language where the patient lives. For reporting and analytics, the data in the app is automatically synchronized with a copy of the patient's record in the cloud. The cloud copy enables comprehensive public health data dashboards and analytics, all in real time, showing the status of cancer care, for example, by age, location, comorbidity, etc., all at a fraction of the cost of current manual time-consuming methods of reporting and analytics. The app can be multilingual and available in multiple languages. So in summary, through the app, we can deliver a comprehensive digital support to patients before, during, and after their cancer referral, diagnosis, treatment, and follow-up throughout their cancer journey, efficiently and exceptionally cost-effectively, that is simple for any patient to use, always with them on their mobile phone, and that also delivers real-time reporting and analytics for national population health management. Thank you very much for watching.